Hi, I'm Kathleen.
And I'm Jesse. We're nursing students at the University of Delaware.
And this is just some tips to prepare you for your health assessment test out. So first, prepare a lot for this test out. Treat it seriously. Pretend you're actually going to assess a patient. So be serious, don't be laughing through it.
Okay. And when you're doing the test out, you want to make sure you're organizing it so the patient is moving around as little as possible. Because if this were an elderly patient, you wouldn't ask them to lay down, stand up, sit down. You want to keep them moving as little as possible.
Know what you're going to do next, so don't wait for your patient or your partner to prompt you. Always know what you're going to be doing next and always explain everything to the patient.
Yeah, it's not the patient's job to cover their left nostril for you. You need to tell them, cover your left nostril and breathe, cover your right ear and listen, lay back, do all that. And if you do forget something on these computer screens here, you will have the blank rubric with you. But that is to just remind you if you get stuck or if you're pausing, it's not to serve as a guide throughout the entire test out.
And verbalize all of your findings for the instructor. You wouldn't be doing that in a real assessment, but just so the instructor knows that you know what you're doing.
And again, just make sure you're preparing. This isn't a super hard thing. If you come prepared, you'll do fine. And there's no reason you shouldn't be able to get a 10 out of 10% of your grade.
Good luck.
Hi, my name's Jesse. I'll be conducting your physical exam today. If you want to hop up on the table. Can you tell me your name and date of birth?
Kathleen Luckner, 12/29/93.
And can you tell me the day of the week and what building we're in?
It's Wednesday and we're in McDowell Hall.
Alright. 21-year-old female, appears her stated age, alert and oriented ×3. Speech is clear and content is relevant. Skin is tan with even pigmentation. Patient appears well nourished with even body fat distribution. Sits comfortably and erect on the examining table. No obvious physical deformities, and gait was smooth and effortless upon entering. Next, I'm going to be inspecting your hair and face. So hair is brown with thick texture and even distribution. Now I'm going to be looking through it. No lesions or infestations. Head is normal cephalic. Facial features are symmetric with no involuntary movements. Next, I'm going to be performing a couple of eye exams. So for the first one, if you could occlude your left eye, and I'm going to be testing your fields of vision, so let me know when you see my fingers.
Now. 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 Now.
Now I'm going to be testing the other eye for the same thing, so go ahead and cover the other eye, and tell me when you see my fingers.
Now. 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 Now.
Fields of vision intact by confrontation bilaterally. Next, I'm going to be testing the cardinal positions of gaze, so just follow the pen light. Able to parallel track object, extraocular muscles intact bilaterally. Next, I'm going to be assessing your pupils. And if you can look at the pen light over my shoulder, and now look at it as it comes to you. Pupils are equal, round, reactive to light, and accommodation. I'm next going to be looking at your ears. Let me know if this hurts.
No.
Okay. Ears are equal size bilaterally without swelling or thickening. They're aligned appropriately on the head without lumps, lesions, or tenderness. And there's no discharge in either ear. Next, I'm going to be performing a variant of the whispered voice test. So go ahead and cover one ear and let me know when you hear my fingers rustling.
Now.
And cover the other ear.
Now.
Good. Passed whispered voice test. Next, I'm going to be assessing your nose. If you could cover your left nostril and breathe in. Now your right nostril and breathe in. Nares patent, if you could look up for me. Nasal cavity mucosa is red, smooth, and moist. No swelling, discharge, or foreign body evident. Next, I'm going to be looking at your mouth and throat. You could open your mouth for me and say ah. Okay. And under your tongue. And if you can stick out your tongue for me. Great. Lips are without cracking or lesions. Teeth are white, straight, evenly spaced and clean. Gums are pink with tight margins. Tongue is moist, pink, even, and roughened. Mucous mucosa is pink, smooth and moist. Hard palate white, soft palate pink. No lesions. Uvula arises midline on phonation. No unusual breath odor. Oropharynx is pink without exudate. Tongue symmetric, protrudes midline with no tremor. And no lesions under the tongue. Tonsils were 1+. Next, I'm going to be assessing your breath sounds. So I'm going to be behind you here, and I'm going to lift your shirt up. And every time I move my stethoscope, take a deep breath through your mouth. And I'm going to be assessing in all 5 lobes. Deep breath. Deep breath. And one on the side. Breath sounds are clear in all 5 lobes, no adventitious sounds. Next, I'm going to be checking for CVA tenderness, which is kidney pain. So just let me know if this hurts.
No.
No CVA tenderness. I'm going to begin the cardiac assessment. The first thing I'm going to do is listen for bruits in your carotid arteries on both sides with the bell of my stethoscope. So if you can exhale and hold. And now I'll be checking the other side. Same thing, exhale and hold. No bruits in the carotid arteries. And next, if you want to lay back, I'll be listening to your heart sounds. So I'll be listening in 5 spots for this with both the bell and the diaphragm. First is aortic, pulmonic, Erb's point, tricuspid, and mitral. Now I'll be listening with the bell of the stethoscope. That was pulmonic, Erb's point, tricuspid, and mitral. Okay. S1 is louder than S2 at the apex. S2 is louder than S1 at the base. There are no extra sounds or murmurs. And now if you can lift up your shirt, I'll be inspecting your abdomen. Flat contour, no asymmetry, masses or bulges, no lesions, scars or striae present. Next I'll be listening with the diaphragm of my stethoscope for bowel sounds, starting in the right lower quadrant. Bowel sounds present in all 4 quadrants. Next, I'll be lightly palpating around your abdomen. Just let me know if you have any tenderness. No tenderness to light palpation. Next, I'll be doing the same thing, but palpating deeper. So again, let me know if there's any tenderness. No tenderness to deep palpation. If you can sit up for me here at the end of the exam table and take off your socks. Okay. First I'm going to inspect your legs. First I'll be inspecting the skin. Skin is warm and dry bilaterally. There's no redness, pallor, cyanosis, or lesions. No pretibial edema, swelling, or atrophy of the calf muscles. Hair is present and evenly distributed. Next, I'll be assessing your pulses. First is the posterior tibial pulse. And I'll be checking the other side. Posterior tibial pulses are present 2+ and equal bilaterally. Next is your dorsal pedis pulse. Your dorsalis pedal pulses are 2+ and equal bilaterally. Next, I'm assessing for cap refill on both feet. Prompts capillary refill. Last thing I have is your neurological assessment. So first is cranial nerve 7. If you can frown for me. Close your eyes tightly. Smile. Puff up your cheeks. And I'm going to deflate them. Okay, cranial nerve 7 is intact. Your facial muscles are intact and symmetric. Cranial nerve 11, I'm going to be behind you here looking at your neck muscles. Okay, sternomastoid and trapezius muscles are appropriately developed and equal bilaterally. Can you shrug for me? And turn into my hand and into my hand. Able to shrug and turn head into resistance. Next, I'm going to be assessing cranial nerve 12. So if you can stick out your tongue and say the words light, tight, dynamite.
Light, tight, dynamite.
Lingual speech is clear and distinct. Trunk protrudes midline with no tremors. The last thing I'm going to do is assess your motor strength. You can go like that with your arms. Don't let me pull them. Don't let me push them. Good. Same thing with your legs. Don't let me push them. Don't let me pull them. Don't let me push your legs down. Don't let me push your feet down. Don't let me push your feet up. And then grab both my fingers and grip. Okay, muscle strength is good. Grade 5 and equal bilaterally. That concludes my portion of the physical exam. Do you have any questions at this time?
No.
Okay, and that'll be it. Thank you for your time.
Thank you.
One last message from us here. When you're done the test out, just take a second, look at the rubric, see if you're missing anything. And if you are, don't say, oops, crap, I forgot something, let me go back and do it. Say, let me just check one more thing. Go ahead and check. And then conclude your test out, ask the patient if they have any questions or anything like that. And just be formal, give them a nice greeting, and that'll be it.